Special, Scotland Today, Scottish Television, Cowcaddens, Glasgow. And a specialist consultant. Learning the hard way has left her in a worse condition than when she started.
I was quite shocked at the marks on my face, where the needles had been put in, and these seem to be the marks that I've been left with, is really where the needles have been put in. Because I never had any mark on the other side of my cheek that could really be seen. It was only one side. Now I'm left with marks on both sides of my face.
Because she went privately, there's no clinical complaints procedure whatsoever, and the medical ombudsman has no jurisdiction. But that's not all. A clinic can refer you to a doctor who doesn't specialise in plastic surgery. Qualified surgeons have to pick up the pieces.
We have had problems with some of the operations to reduce baggy eyelids and the type of thing where far too much tissue has been taken away and the patient's eye won't close, and you have to put in grafts or do other procedures to protect the eye. And other things like nose operations where they've been inadequately done or improperly done.
And nobody can stop any surgeon from doing any surgical operation. Even if you are not a surgeon, you can operate on patients, provided that you don't tell them that you are a qualified surgeon or whatever.
Many of the clinics they have advertised do not employ trained people. And the important thing for any patient is, as near as possible, to have a completely trained person to do the procedure. It is much harder to operate on an animal than it is on a human being.
The Disfigurement Guidance Centre gets hundreds of letters a year from people who've fallen foul of a surgical procedure.
There are many people perhaps exploiting people's desire for plastic surgery. A good guideline is to never go to someone who is advertising, because reputable and properly qualified consultants are rather loath to speak out publicly. There is a wide open field for charlatans and people who have no care for the people that they are professedly improving. Go to your own GP. If your own GP is not sympathetic, contact us, because perhaps we can help you to make an approach to your GP which will seem more reasonable.
Let me have a good look at it. All right. What was the original problem?
But don't let us frighten you off cosmetic surgery. Jean Stevenson wasn't happy with the shape of her lip after an accident, and she doesn't regret having it sorted through her GP and by a qualified plastic surgeon.
My lip was quite grotesque looking. I was self-conscious of myself. I'm terrified of hospitals. And I thought, oh, what have I done now? But once I was there, it was very nice.
Would you have any advice for anyone tackling this kind of operation or feeling that they didn't really want to go through with it? What would you say to them?
I would just say to go for it.
And you can contact the Disfigurement Guidance Centre at P.O. Box 7, Cooper, Fife. Tomorrow we look at the work of Canniesburn Hospital in Glasgow and